I'm Dr. Yashoda Tanikachalam, who has served in the central government as pediatrician and a family physician. Now, after retirement, I'm working for Nesavidya as an honorary consultant pediatrician. Today, we are going to talk about the first 1000 days of life of a child. The first 1000 days means the 270 days of pregnancy, 365 days of the first year of life, 365 days of the second year of life. That comprises 1000 days of life. Why do we give so much importance for this? Because it is a continuum. The baby, when it is formed, it gets formed on the 15th day of periods. So by the time you know that you are pregnant, the baby's brain, the heart, the body, everything gets formed. And it is a continuum. If you give proper care during pregnancy, the baby is going to be healthy, the intelligence is going to be normal, and is going to be having a lot of immunity against infections. That is why it's very, very important to take care during pregnancy and the first 2 years of life of a child. So the countdown starts on the day 1 of pregnancy. Hence, it is important to know what are the do's and don'ts during pregnancy. So the first thing we need to know is, are you having enough good sleep? That is about 8 hours a day. You can do the household chores as you are used to. There is no need to panic. It is not a disease. So you can continue to do your household chores as well as outside work. See to it that you get 8 hours of good sleep. And then there is no need for any special kind of food. Whatever food you are accustomed to, you can continue to take the same food. The only thing you need to remember is you need to gain 1 kg of weight per month. That is, at the end of 10 months of pregnancy, you should have gained about 10 kg of weight. That will suffice for the growth of the baby. So when we meet for the first time, when you suspect pregnancy, what do? You go to the doctor. The doctor will do a urine gravidex to confirm the pregnancy, and then she will order for an ultrasound of the pelvis to confirm that the pregnancy has happened inside the uterus, not in the tube or elsewhere. Once she sees by the 6 weeks, the heart starts beating. So it's very important to have a doctor visit. And the doctor will take your entire menstrual history, previous obstetric history, and a detailed family history for 3 generations, as well as yours, as well as your husband's too, to note, is there any chance for a genetic disease? Is there a chance for hypertension, diabetes during pregnancy? And if you have any infections, please get back to the doctor. And if you have convulsions, diabetes, hypertension prior to pregnancy, you need to consult the doctor to continue the appropriate medication. You can, some people can develop diabetes during pregnancy, hypertension during pregnancy. That will be treated adequately by your doctor, either with the insulin injection or with tablets. So please continue your medications as prescribed by your doctor. And then the thyroid deficiency will be evaluated by your doctor, that you have to take it throughout pregnancy without a break. It's very, very essential for the baby's growth as well as your health. It is as essential as oxygen for every tissue of yours as well as that of the baby. And then many of you have a doubt whether you can continue to do your household work. Yes, you can. But as we discussed earlier, please sleep for 8 hours. Whichever position is comfortable, you can adopt that position for sleeping. You can lie on your back. The baby cannot come out of the uterus. There is no need to lie on your sides. As long as it is comfortable for you, you can lie on your back. Then the problem you can develop is that every woman has is anemia. 90% of the women are anemic. So you have to take iron capsules, for folic acid tablet and calcium tablet from the beginning of your pregnancy. As soon as you know that you are pregnant, or even before you are contemplating pregnancy, if you take these 3 tablets, it will be very wise for you as well as it will be healthy for the baby also. So continue throughout the pregnancy without a break. And when the anemia becomes severe, we might give you an iron injection also for 5 or 6 occasions, which is very safe for yourself as well as for the baby. And then we evaluate you for other infections like lung infection, urinary infection. All the infections will be treated adequately. We will evaluate your heart, your lungs, and other sexually transmitted diseases It is routine for everybody. And then the hepatitis B and A and C also we will screen you. Your blood group will be evaluated, and sometimes we might take an ECG and echo also for you. It is mandatory, as well as it is available free of cost from all the government facilities. Avoid strenuous exercise, avoid panic, and take care of your body as well as your mental health. All your questions will be answered by your doctors. And then many of you get constipation. That is the commonest problem we face. It is a normal phenomena. There is no need to panic. You can increase your fiber intake. That will relieve you of the constipation. There is no need to take any medication for relieving constipation. So what are the things you need to note during pregnancy? Any excessive weight gain or lack of weight gain, you should report to the doctor. Lack of fetal movement, any discharge from the vagina, the swelling in the limbs, headache, blurring of vision, all these things you need to denote to your doctor. Then what are the things you need to keep ready for delivery? Clothes for yourself for 3 days, clothes for the baby, nappies about a dozen of them, towels, toilet items, all these pack them and keep it ready. Do not panic, always be calm so that you are prepared for your delivery. And then the contact numbers you should store are your husband's, your mother, sister or friend, the ambulance driver. In case you don't have any brother or sister, you can contact even the neighbors and friends, and the hospital number and the doctor number. All of them should be written in bold letters, and keep 2 or 3 copies. Paste them in prominent place. Give a copy to your helper too. Please remember that all the precautions you take are going to help the baby, and be prepared for the breastfeeding from day 1. Your doctor will help you how to breastfeed the baby. From the 5th month of pregnancy, she will inform you how to take care of the breast so that you are ready to feed the baby on day 1. Please do not panic. Your doctor is there to help you. And any other queries, you are free to ask us. We are there to help you. And please remember, your child's future is in your hands, and your only child's future is in your hands. The health, the basic health, the physical health, the mental health, and all his academic achievements, everything depends on the first 1000 days of life. It's very, very important.